The health officials in Nakuru now say a Chinese man who arrived in the country 3 days ago and was quarantined in his house in Nakuru does not have coronavirus. According to authorities, the man had traveled to visit his family in China in December last year before traveling back 3 days ago. The man arrived in Nakuru on Sunday showing symptoms of an upper respiratory tract infection. The man had taken a taxi from the Jomo Kenyatta International Airport to his house in Nakuru's Upper Hill estate.
He arrived from China on 10th February, that is 9 days ago, at 11:30 p.m. And he was driven from Nairobi in an Uber, whose contacts of the driver and the number plates we have. And we visited him yesterday in his place. The county government of Nakuru has stocked on PPEs and thermoguns, and therefore our health staff visited him well dressed, and they interviewed him and examined him. First and foremost, he does not have any signs and symptoms, and therefore his condition does not meet the standard case definition for coronavirus infection. He was screened at JKIA and released because he didn't have any problem. When he came to his home, he self-quarantined himself in his servant quarter. He is married to a Kenyan, and they have 2 children, one aged 5 and another one aged 1. And the spouse and the children are in good condition. And the man in question, who is a Chinese, is also in good health. So we promise to visit him daily, and we will be giving information to everyone who deserves to get. Obviously, we shall not disclose the identities of our clients. The other thing that we have done as a county government is that we have trained 200 staff from PGH, Gilgil and Naivasha hospitals on coronavirus, signs and symptoms, and the management of the same. And we have also stocked on PPEs and thermoguns and sanitizers, which are alcohol-based. And we have made a quarantine facility at the PGH. So generally, what we have done, because of the stigmata that has been created in that village, we have organized with the DCC in Nakuru West Sub-County that we shall have a meeting with the community, maybe tomorrow, so that we can sensitize the community on what coronavirus is and the possibilities of it being here or not. And the fact is that we don't have anything. And we have only just told the clients that they should continue with the self-quarantine for the remaining 5 days, and the basic hygiene, that is washing hands with soap and water, or using an alcohol-based sanitizer to use for your hands. So generally, that is where we are.
So currently, just for clarity, is this patient, is this person being observed, and you are saying he didn't expose any sign? Was he sick after getting to the country?
The patient, as per the history we have, has never been sick since he came, and from our examination yesterday, he didn't have any abnormal signs or symptoms. His temperature is normal. Apparently, he's also taking his own temperature since he came, and the records as the temperatures have been normal. Nobody had met him before yesterday in terms of us or the provincial administration. And when we went there yesterday and examined him, he is in good health. And as I've just said, he does not have any signs of symptoms to fit in the standard definition of coronavirus infection. Coronavirus is a fairly new thing that wasn't known, and it's a viral infection. What we know is that although transmission from one person to the other one is very quick when they're in short distances, but we also know that people who get it, about 80% of them will fight it through their normal immune system. The little information we're getting from WHO shows that the people who have an underlying condition that depresses their immunity are the people who mainly are facing mortalities. So really, there is nothing much to fear. First, because we don't have those cases in this republic. And in case we ever have, we have the labs to diagnose the same, and I think we are fairly prepared. I'll talk on behalf of Nakuru County to say that we have trained the 200 staff as of now, and we have stocked up on PPEs and the thermoguns and the sanitizers, both for health workers and everybody else. What we really need to do, and which I think is a priority, is to sensitize the public so that they know. Because when they see it every day on the media, it is giving fear to people, and they are justified, mainly because they don't have the correct information. So we need to educate our client, because that will be our biggest weapon in terms of making them live a normal life, and in case we ever have it, so that they can know how to protect themselves. Basically, basic hygiene of washing hands and just using sanitizers is good enough to prevent some transmission. And for our health workers, if I may address them, they are already aware that we have stocked up on those PPEs and they have nothing to fear. The ones we are sending there are actually going there in PPEs and everything, and the thermal guns, so they are not coming in close contact with our client. But I want to insist here again, first, he is not a patient, he is not sick, and so we will only stop there. But we are monitoring him daily. We'll get the report from their family today, again, just to see how he's doing. And in 5 days' time, that is 14 days after he arrived, because I said he arrived on 10th of February, we'll have seen how he's faring.